Hello and namaste, everybody. I know I'm coming on video for my friends in India after a long time. Today, I wanted to talk about medical billing process again, and believe me, last 2 months, it was really crazy. I was in India for some time. But I have read a lot of YouTube comments, so thank you so much for your love and listening my video, watching my video, understanding medical billing, how you can make your career, how you can progress in India, staying in India and adopt medical billing as your career. So one thing was very clear, there are a lot of people who are very excited, whether you are working in a BPO call centers, you're working in somewhere where you might not be into healthcare or US healthcare, but wherever you are, medical billing and coding is one industry where this world, and especially US, requires thousands, not only thousands, millions of workers globally. So this is a huge opportunity, which is totally underestimated so far. But I can tell you, if you are very serious about learning medical billing and coding, and adopting this as a career, there are huge opportunities out there. I'm going to talk about a few things today. There were two questions which were asked primarily in my previous videos. And one video I did where I explained you the entire medical billing process, what it is, how it works, how can you adopt medical billing and coding as your career. But out of that, there are two questions come. One, how can we start? If you are absolutely brand new, a graduate coming out of college, you have a good English, and you want to move your career into medical billing, coding, or a BPO or a healthcare sector, what should you be doing and how you can start? That's the first question. And then the second question, which is opposite to that, which a lot of people ask, that after spending 3, 4, 5 years in medical billing and coding, what do you see as a future? How can I grow myself and continue to keep growing my career? And how do I see myself after working for 5 years in medical billing and coding industry? So these are two burning questions, two very important questions. Both questions are fantastic. Today, I'm going to talk about how you can enter into medical billing and coding field, because that's a very important question. So suppose you are coming out of college, you're a graduate, and the first and foremost thing which you have to see is that you have to have a functional English. You have to have a reasonably functional, good English which you should be talking about. And I'm going to talk about that a little bit. Oh, I got a call. Okay, don't worry about it. So what that means is that at least you should be able to understand English from the basic computer systems, and especially some of the medical terminologies. Now, medical billing does not mean that you are going to speak or learn or read some kind of clinical knowledge or clinical understanding, or you will have to have some kind of biological background. No. As long as you have a reasonably good English, where you can understand some of the US standards, some of the US standard grammar, then you should be able to understand it. It's more like a business process. So from the business perspective, if you can understand this business process, which I had in my medical billing class earlier, then it is very easy to adopt a career, because 99% of the time, people who does medical billing and coding, or the companies, they have a very structured process. And when I say structured process, means they start from A, reach to Z in steps. So everything has a step and everything is a fixed process. You have to just have a process knowledge. You require a process knowledge, and you also require a logical sequence from top to bottom. Because ultimately, it's basically, you are working on behalf of doctors in USA, and you're getting them paid from the insurance company. That's a one-liner on medical billing. Now, during that process, you have several small processes, from charge entry to data entry to claim submission to payment posting to denials, working on AR, and then ultimately maximize the insurance reimbursement for a physician or for that medical process. So how do you enter into that area? That's the most important thing. And the first and foremost, I tell everybody, you should have a passion to understand and learn that process. You should have a passion to work in the US healthcare industry. You should have a passion to resolve patients' questions or patients' problems, which is non-clinical, administrative. You should have a passion for that kind of process. Just don't do it just because you want to do it, you want to make earning, or you want to have a living. This is not just for your living. The first and foremost, you should have a passion for that. Now, if you have that thing, then join a medical billing and a BPO company who are actually doing that kind of process in India. Now, identifying that kind of billing, I'll give you a little bit idea how you can identify what process it is. So when you go for an interview, try to interview the company owner or whoever is offering your work, what kind of medical billing that company does. There are few ideas which I can give you. The better the specialties are, there are better chances for you to learn or have a growth in that company. Because what happens, there are a lot of companies, I'll give you an example, like pharmacy, dental. These are the low paid areas where reimbursement or insurance reimbursement is not very high. So there is nothing much to learn and do when it comes to medical billing. But when it comes to the specialties like cardiology, eye, or anesthesia or pain management, where there are each visit reimbursements are higher. And if the companies who are doing those kind of visits or specialties, or those who are into hospital billing or coding, where margins are more, where the reimbursements are high, there is a better opportunity for you to learn and grow in that company. So when you go and interview a company or you are being interviewed by any company, try to find out for how long that company is in that business and what kind of specialty billings that company is doing. That's a very, very important question, because then you can be sure that if the company has good margins, they have good reimbursement, they have a stable client, then it's much easier for you to learn the process there. And once you know that, you know exactly where they stand, then it's much easier for you to identify that opportunity. And I think that's where you should bet upon your career, because you should not look for a company who is paying you 500 rupees or 1,000 rupees more. You should look upon a company which can give you stability for next 1 or 2 years to learn this business process, which is called medical billing. So that's where you should start. So I hope now you have a good understanding and a knowledge. And even if that company is not in your town, you have to travel somewhere. First 2 years, try yourself where you can find a reasonable amount of money as your salary, but you learn a lot into medical billing and coding industry. So with this, all the best. And if you have more questions, write your comments in YouTube, and I'm going to give more tips for medical billing and coding later. Thank you. Have a wonderful day.